This is a piece of colon that was removed. You can see normal colonic mucosa, which is what it's supposed to look like, versus the shrunken malignant portion of the colon. And again, we do go in and we cut this out and hopefully be able to reconnect it rather than giving you a permanent colostomy. When the cancer gets too advanced, it becomes more difficult. This is somebody that we're resecting a portion of the liver. So this is stage 4 disease. And you know, similar to breast cancer, while you have over a 90% survival from a stage 1 disease, here in colorectal cancer with stage 4 metastases, you have less than a 20% chance of 5-year survival. We measure our outcomes in terms of 5-year survival. I'm not a urologist, but I'll touch briefly on prostate cancer, since this is another thing that disproportionately affects men of color. Over a million, little over 1 million cases a year in North America. And most of the treatment now, in the past, the treatment for prostate cancer was very aggressive regarding radical prostatectomy, which leads to significant functional, including sexual deficiencies, which is clearly not preferred. And so most of the treatment now for prostate cancer is centered around certainly PSA testing, aggressive rectal exams, and making sure that the disease is picked up at an early stage. But most of the treatment now is moving away from the more radical treatments to hormone deprivation therapy. Not even so much chemotherapy, but to manipulating the hormones and decreasing the level of androgens in the system, so-called androgen starvation for most of the prostate cancer. So I'll pause here in the interest of time, and I certainly look forward to taking questions in the question session. Thank you.
Very, very much, Dr. Reed. And while we load the next talk, it's interesting that PSE has pointed out the need for centralization in cancer care and centralization, Minister, of that expertise and collection of the different tissues, so that your expertise, if it's spread out across these small island states, is going to result in inefficiency in the system. And I think it's something that we can discuss further in the question and answer session. I also want to welcome the other stakeholders in health in Jamaica, some of whom have joined us. And I know the minister discussed their opportunities that exist in the health sector for collaboration in diagnostic care, etc. So I hope that there will be some discussions as we go along later in the day. If you could load the next talk for us, for Dr. Gary Rule. He's the director of the Department of Health at Hartford in Connecticut. He is actually an engineer and an MBA, so he ventures outside of healthcare and is a businessman. But he has done a lot of work in mental health. Gary is the author of Sailing on Broken Promises, Essential Survival Skills for Recovery from Mental Illness. He trained at the University of Rochester School of Medicine and Dentistry and did his internship and residency at Waterboro Hospital. Gary, I want to welcome you again to Kingston, Jamaica, and we look forward to hearing your talk this morning. Ladies and gentlemen, Gary Rule.
Thank you and good morning. Distinguished guests, dignitaries, and friends. Actually, my talk can be done in 30 seconds because it really starts with Bob Marley's song, Jammin'. And what I'm going to present to you really is just an idea, concepts about having centers of excellence using the 3 first words, J-A-M, J meaning joining, A, asset mapping, M, meaning and measurement, and then to digitize that, capture that in information, and then use that as a product, because the knowledge that we gain in public health is a good and a service that can be used for other persons to package that information and basically sell it. So if you think about, as the slides are going up, if you think about planning a party, what you do, who you invite, when do they come, and what if you ask folks what to bring. What you don't want folks to do is come to the party all at 6 o'clock, bring 100 pans of curry goat, when you know half the folks don't get there until 7 o'clock. So you really have to plan it down to a science. And last night at the buffet last night, what struck me was I walked by a buffet and there was left Grater cake on the table, right, at 10 o'clock. And my thought was, well, why is that left there? Is it because it's in the wrong place? It's the wrong time? It's that somebody thought Miss Maddie made it, I didn't trust it, and therefore I'm not going to use it. But that's really what healthcare is about. Right place, right access, right people coming at the right time, bringing the right goods, and then what you do is the science of it, you then look. How many people came? How many ate the curry goat? When did they eat it? How many ate the Grater cake? When did they eat it? Why did they not eat it? Use that information and then plan ahead, kind of doing predictive modeling. So that's really my talk in 30 seconds. Am I controlling my slides? Okay, so if I run out of time, just remember 3 things. J, joining. A, asset mapping. And M, meaning and measurement, meaning turning every single piece of data into information. Information has to be turned into knowledge. That knowledge you then can use to develop other countries who are emerging, anyone who comes to you, because that's really what the US does. And that's what a COE means.